Today, I'm delighted to welcome Christophe Jauquet. Christophe is an internationally recognized author, keynote speaker, and one of healthcare's most thought-provoking voices on the future of consumer health. He spent years exploring how people are becoming more proactive participants in their own health, and has coined the term Healthusiasm to describe this growing movement. Today, we'll explore what that means for healthcare, why traditional boundaries between healthcare, wellness, and consumer experiences are beginning to blur, and what leaders need to do to prepare for what's next. Christophe, welcome to Frontiers Health Voices.
Hi, Kristen. It's super nice to be here, and you did pretty well with that introduction. I much appreciate it.
I pronounced your name correctly?
You did it perfectly. Thank you.
Awesome. Well, so for people that may not know about your work or who you are, maybe you can just tell us a little bit about yourself and what sparked your fascination with this aspect of healthusiasm and consumer behavior. How do you define it?
It's an interesting development. I mean, we always end up in pieces of our life that maybe we didn't saw coming, and it was exactly that. I think as a teenager, I was very much interested in trends, fashion trends, and how the world was changing and how the world or change in the world was impacting the way that people dress. I then studied business economy, strategy, innovation at the university and business schools. And I ended up in pharma, health, where I stayed for over 13 years and where I was an innovation manager. And so at a certain point, I combined all three of those things, meaning I had the business strategy, business innovation, which is my education. I had the business experience in health, and also, my relationships, my ecosystem was in health. And I was still very much interested in how the world changed and how that influences people. And I kind of bundle that all together in what I do today, which is inspiring audiences and organizations about exactly that. How is the world changing, and how does that impact health and happiness, whether it is an institution or whether it is a person? And I think to conclude that, I think the very important moment for me was when I started writing my first book, which was called Healthusiasm.
Right.
And that was the moment when I brought it all together. Say it again.
Right. And you have a podcast of the same name, right?
I have a podcast. I have a website. I'm thinking about a fashion clothing line, athleisure wear type of thing. I have workshops. I have a whole, models and frameworks that help organizations to really think in basically the way that I look at the world and the way that I think. So there's a lot underneath Healthusiasm. It's everything that I stands for, basically.
Interesting. Well, I look forward to seeing the clothing line. So I know we've talked before, and you've mentioned how consumers are spending significantly more on wellness than healthcare, and that you believe that the healthcare industry, the more traditional healthcare industry, has underestimated just how motivated people are to invest in their own health. And maybe you could talk a little bit about that.
Totally. And I think the way that you just describe it is exactly what Healthusiasm is all about. It's the enthusiasm that people have to be healthy and happy. And if I explain it to people, one of the most obvious questions that always come about, and it's not such a stupid question actually, is haven't people always been interested in their health? And that's actually true. I mean, if you go back even 2,000, 3,000 years, I mean, people were bringing offers to the gods, people were praying, people were doing lots of things to have an impact on their health. Now, what we've seen in the last 40, 45 years is that we have increasingly more, if you will, impact on our health. It really started in the 80s with Jane Fonda, a person you probably still remember.
Yeah.
And it was actually the first time where people started exercising specifically to have an impact on their health. It was related to beauty, but even then still it was related to their health as well, and the way that it made them feel. And ever since, we saw more and more technologies, because that was VHS, right? So, but we saw more and more technologies coming up. In the 2000s, we had Dr. Google, then we have wearables, we had social media where you can find other patients, we now have AI. And that was basically one of the biggest evolutions, where we actually are more empowered than ever. We always say the patient is empowered, people are empowered. But ever since, the 2000s mainly, we have more and more information and tools that are at our disposal. And at the same time, we saw that the psychology of people changed, because we live in societies where our basic and our social needs are largely fulfilled. So if you look at the Maslow pyramid, then you see that people are more and more becoming aspirational. So they have everything they want in life. So they want to become a better version of themselves. And so everything in society is evolving into that place where we want to have more impact on our health. And indeed, if you look at studies by Lululemon, for example, it says that 99% of people, or 98% of people, are more occupied with their health than the year before. So that's basically everyone, right?
Wow.
So that's a lot of people. And when this happens, you see more and more brands moving into that space, non-healthcare related companies that want to have an impact on their health because they know that their customers are looking for those kind of solutions. Mm-hmm. So you have technology, you have the psychology and the society that is changing, and you also have the businesses that are trying to help more and more people. And that is exactly why we see more and more people occupied in their health. And to me, this is one of the biggest opportunities for healthcare. And at the same time, maybe as well, one of the biggest threats for healthcare, because they started doing things themselves.
Right. And so, as you said, like we know that consumers are working on their own health and how I have the Aura ring, I've got the Apple Watch, I have all sorts of things. I'm going to hot yoga, I'm bouncing on my rebounder, and so I am motivated. But healthcare has traditionally been designed around treating disease. So what does designing for actual health look like?
Good question. I think the way that we looked at healthcare was always in the deeds, and the way that we looked at sick care, right? It was somebody was sick, we needed to solve something. It goes way beyond that today. We don't no longer wait until we are sick to actually have an impact on your health. And that is why you are wearing the Aura ring and the Apple Watch, and that you are on your rebound or whatever it may be. But it's exactly what people want to do. They want to have an impact on themselves. And what you see is that outside of the healthcare system, these companies, whatever company it may be, it could be Apple, it could be the Aura ring, but it could be supermarket Kroger's in the States, or Bartlett's in the UK. There's so many companies, even car manufacturers, home builders, they're all moving into this health space. And the way that they're doing it, and the reason why they're doing it, has all to do with the value that they want to create for their customers. So look at yourself as a customer. If you want to buy something, you always look at what is the value that it gives to me. And if that matches the price, you're willing to pay for it. And what we've seen over time is that the way that value is created has evolved. So there was first the products. A product later turned into a service, or a service was added. For about 10, 15 years, we're talking about customer experience as one of the most important things for you to decide whether or not you want to buy something. Well, we are now moving into what we call the customer transformations, the transformation economy. So no longer the experience economy, but the transformation economy. And more industries are starting to realize that, which means that they're no longer selling a product. They're no longer selling a service. They're no longer selling an experience, but they're selling an experience that makes people feel better, healthier, or happier, which makes them feel transformed. And that is something which we see across all types of industries. And so the way that health solutions are provided outside of healthcare is actually pretty different than what we receive in healthcare. Because in healthcare, very often it's a product or it's a service. Like if you go to a hospital, it is a service, but it's not always a good experience, right? It's no convenience. There's not a lot of personalization. You don't enjoy yourself, let's put it that way. So the value created in healthcare is entirely different than the value that is created outside of healthcare. And to me, there's a huge tension, definitely around these people who are interested in their health, who want to have an impact on their health, who are motivated to do something about their health. But when they go into the healthcare industry, they suddenly don't feel serviced anymore the way that they are on the outside. And that is, to me, one of the biggest tensions that we live today in the healthcare.
Yeah, and I know that you've explored how healthcare is being delivered in other regions of the world. What is there anything that you've seen that inspires you to bring that change to Europe or beyond? Well,
yeah, I think it's everything starts from a need very often, right? It's what we want, but then you need to add an expectation. And I think what we noticed across the globe is that in general, the solutions that are offered, they provide something that answers the need and more answers an expectation. What is the difference between a need and an expectation? A need is something you really need. It's something that you must have. That is the reason why that product or that service exists. An expectation it has more to do with the experience that you want to have with that product or that service. And what we see across the globe is that is kind of happening everywhere. That transformation is a bit, are the things that we see in some industries popping up more than others. And I think when we look at health in general, in the US, for example, there is more interest probably than in Europe right now in these transformations, because the healthcare system requires a little bit more innovation. People are looking for more help. People are looking for more solutions, because the access to the healthcare and the prices of healthcare are completely sometimes too high. In Europe, we have a good basic system, which makes that there's less innovation. There's maybe also less external players who at this moment play into it, although that is changing. And then you have China or all the Asian countries who look at it entirely different. They realize how the world is changing. The governments say, this is where we want to be in 5 years. And then everybody starts building. So it really depends on, the reality of how health is managed in the world and in specific regions of the world, to understand how the differences are and where you can play a role, and who's lagging and who's in ahead, let's say.
Right. And we definitely try to bring those forward at Frontiers Health. And I know you've been part of the Frontiers Health community now for a number of years. What keeps you coming back, and what makes the community maybe different than other healthcare conferences you've been to?
Well, I have to say, it's, first of all, I think talking about examples of non-healthcare companies, I saw a couple of them already at Frontiers Health. I think there was 2 years ago, the bus company, the public buses who drive around and who transport people, they created a bus specifically with healthcare medical equipment to go to more the deserted regions and help the people. So that was a non-healthcare company actually providing health services to people, whether it is diagnostics or even early treatment whatsoever. Yeah. So you see these things already happening also at Frontiers Health. But I have to say, to me, Frontiers Health, I go to a lot of events, and people always told me, even if you don't speak, you have to be there. It's such a fun thing. And I'm like, yeah, but I do so many events already. It's like, if I need to go to an event, it really needs to be good, because I'm spending my time at that event. It's not always that fun. And so there's one person told me that I really needed to go. I trusted her. I went there, and I have to admit that I think it was I don't know if the coziest is not maybe the right word, but it was the place where I felt home is exaggerated and cliche, but I really felt at ease. And I talked with so many people already the first year. And when I came back the second and the third year, it was like, I was so happy to see people again, like yourself, Kristen. It was so happy to see people again, which I haven't seen in a year maybe. And the connections were immediately like it was yesterday. Because you feel like everybody's in that same boat of, we want to innovate, we want to have an impact. And totally. I don't know.
I felt the same way. Because I participated at Frontiers when I was at Novartis as a pharma exec, and then again when I was at Headspace as working for a digital health startup, and now working on the team that's delivering it. And to me, it is the ecosystem that is unique, and I enjoy bumping into people like you and others in the industry that are all kind of in our own pockets of the world trying to push innovation forward. And it's nice to have everyone together.
Yeah. And you said something really well, because one thing that I also noticed, and that the first year I thought it was an accident or a coincidence. But I think the repetition between startups, pharma, healthcare stakeholders, speakers like myself or influencers, that balance is really good. There's not too many pharma or too many digital startups or too many other people. I think the balance is really good as well, which makes it very coherent and very interesting. Every time you meet people, it's like an interesting piece again.
Yeah, thanks for pointing that out, because we do really try to keep the ecosystem equal, so it's not weighted in any one area, that it really, because they're all important, right? The only way you can push innovation forward is by having all of those participants equally represented and not one versus another. So thank you for pointing that out. So I'll leave you with one last question. So 5 years from now, what do you hope we'll look back on and say changed?
Okay, that is an interesting question. 5 years these days is a long period of time if you think about how AI changed the world. And I think we really need to think about, and it's one of the most fascinating evolutions that we've seen in the last 18 months, and that is consumer-facing AI, health AI coaches. So, but really consumer-facing. I did an analysis last year in 2025 across the globe, so from China to India to the US to Africa to everywhere. And I've noticed in my research that there were 24 different consumer-facing AI health coaches on the market. So they were launched in 2025. And one went from digital twins. The other had, within the month, 100 million users, talking China here.
Oh my gosh. Wow.
Yeah. So, I mean, this like the Ant Group, Alibaba, JD Health, they all have tens of millions of users right away. So there's a lot of things happening in that space. And we always looked at, Dr. Google, and Google is the front door of health. I think this is already changing radically today. And so I'm very curious with the improvements of the models that we already are seeing. I mean, from an intellectual point of view, you could argue whether AI health coaches are maybe even smarter than physicians already today. They don't have the savviness and the way to talk with you and so forth, and they still make mistakes, too many even, but they already on average score better than physicians. So if you look 5 years ahead, that front door of healthcare will have radically changed. It will no longer be Dr. Google or a Google search, but it will be your AI-facing health coach, your consumer-facing AI health coach. And I think that will radically change everything. And if you are in healthcare and you are not part of that conversation, which will not happen in healthcare or not in the system, it will happen outside of the system, within your Copilot Health, within your ChatGPT, your Claude, whatever. If you're not part of that discussion, the question really will be, how will you treat the data that is coming in? I think that is the bridge between these two worlds, which today is already very difficult. There's a lot more health data outside of the healthcare system than inside of the healthcare system. While there will be a lot more conversations and insights outside of the healthcare conversation, outside of the healthcare system than inside the system. And so the bridge, the trust, the interoperability, all of these things to me will be either under a lot of pressure or will have been resolved and will be magical.
Yes, the interoperability, if my doctor could see my data and it was all sewn together in one place, it would be amazing. So I hope your prediction is correct and that we do move forward in that way within 5 years. And I just want to say thank you, Christophe. I look forward to seeing you in Berlin this October, and we'll see you then.
I'm looking forward to it as well. Thank you, Kristen.
Ciao.